Good evening and welcome to the program Your Doctor in COVID. I am Dr. Mahendra Carpen and I'm the Head of Medical Services at the Georgetown Public Hospital Corporation and the Head of Cardiology as well. So today, this is how you start off. This is how I will start the program, by showing you how I usually wear my mask when I'm at work. It's not this way and it's certainly not this way. I might as well not wear it at all if I was to put it here. So this is the correct way. All right, so I'm going to take it off for the rest of the program because I'm the only one in studio, so my risk for infecting myself or others is pretty low. Now, interestingly, by now you would have been aware that we are going to be opening up back our airspaces and our airports. And that's an interesting development, and the WHO themselves would have had a shifting view and varying recommendations from the time the pandemic would have started to now. So that's something we will tackle head on in tomorrow's program, and to let you understand some of the rationale and the reasons behind the changing recommendations from international bodies as well as the local authorities. So make sure you tune in tomorrow for some of that information. So over the course of the weekend, the questions started coming in, and one of the very intriguing questions came from a friend of mine. Remember, if you have your own questions, send them to the email address provided, or you could WhatsApp it to the WhatsApp number that is provided on screen, and feel free to send them in, and we would try to answer them as early as possible in the most appropriate and friendly way possible. So here's a question that came to us from the owner of a business. My clerk has been home because her husband tested positive. Her test is positive, but the results only was known 10 days after she took the test. So the husband tested positive because he was concerned after developing symptoms. Some of the symptoms that we look for and we become concerned about in COVID-19, things like fever. Fever is the number one trigger for this suspicion. So these days, once a patient has fever and presents to a health center or makes a call or seeks advice, you have to think that this may be COVID until proven otherwise. Coughing, shortness of breath, or difficulty breathing, chills, muscle aches, headache, sore throat, new loss of taste or smell, congestion or runny nose, nausea or vomiting. I believe this patient who we're discussing had fever and some cough with muscle aches, and thankfully no shortness of breath. So that's an interesting scenario, and the questions posed by this perhaps is more common than we think, and it's not just this individual who is encountering this scenario. So let's look again at each one of the individuals that are involved, okay? So let's look at the husband as we try to answer this in some detail. The husband was positive 14 days ago. He was tested after he developed symptoms. At this stage, which is over 2 weeks later, he still has some occasional cough, not all the time. He feels tired and there is no fever or shortness of breath currently, and he has been free from those since about 10 days now. Okay, so let's then look at the wife. Obviously, they live in the same house, and so after the husband tested positive, luckily the husband received his test early after it was done. The wife also decided that she was going to get tested, even though she had no symptoms. Now, 10 days later, she got her results. It was positive. And still, 10 days later, she still had no symptoms. How do we address the several issues that come up here? What do we do? What kind of treatment should be advocated? What are the implications for both of them actually returning to their jobs? And what is the role of isolation or quarantine in this particular scenario? So let's go back to the husband. 14 days ago, this person tested positive. According to WHO standards, if you have 10 plus 3 days of being symptom-free, and those are the big ones: fever, cough, shortness of breath. The occasional cough does not fall under that category. So if you have 10 plus 3 days of being symptom-free after you would have tested positive, then the WHO no longer considers you to be a risk to the society, and you may re-enter the workforce. So by all recommendations and all intents and purposes, we believe that the husband should be able to get out in society and get back to as close to normal activities as possible, but follow the precautions that are already established. Wearing of the mask, washing hands, social distancing, and of course be vigilant for any resurgence of symptoms, any worsening of symptoms. Now, why do you think this person has a persistent cough? Or even if it's occasional? Like any infection in the lungs, anything that affects the lungs, there may be a prolonged inflammatory process that sticks around for days, weeks, and sometimes even months. And it can also develop what we call hyperactive airways. Not asthma or COPD or one of those conditions, but the airways themselves remain somewhat irritable and inflamed and can cause the occasional coughing, which is accompanied by some production of sputum or what we call phlegm or mucus. Sometimes even the sinus draining can cause this cough reflex to be activated, and this person can have the occasional cough. So based on all standards and guidelines, this person is not considered a high risk to society to re-enter the workforce. Things that we would recommend for the husband to do would be to follow the simple established recommendations, as I mentioned before, and then to do the other stuff that will help to boost his immune system. The vitamin C, the zinc, vitamin D, etc. And in an earlier episode last week, we talked about all the different kinds of foods that we can use if you don't have access to tablets that would help to boost your body's sources and your body's reserve for these important defense building blocks. So that's what the husband should follow. What about the wife? So let's look at the wife again. So the wife was tested after the husband. She has had absolutely no symptoms, even 10 days after. Now, it is likely that the wife may have developed antibodies, as the husband would have at this stage, and so somewhat have some level of protection. It is very rare, but possible, for persons to have double infection, meaning they have an early infection, they recover, and sometime later they have another bout of this infection. It is possible, but thankfully very, very rare, and in fact we could actually identify these people around the world. I believe we would have had one such case in Guyana. There have been cases reported in South Korea and in Japan, but it's rare enough for us to actually pinpoint these individuals. So what do we recommend for the wife? According to all recommended guidelines, as mentioned for the husband, the wife is not considered now to be a risk to society. She has never had symptoms, and once she has the 10 plus 3 days being symptom free, she would then be free to re-enter the workforce, free to re-enter society, go to supermarket and do all of the things that she used to do before becoming concerned and getting a positive result. At this stage, there would be no specific treatment recommended for either of the two. What we would recommend is for them to continue boosting their immune systems with things like vitamin C, zinc, D3, hydrate, stay active, and of course the recommendations for wearing masks all the time when in public places, and of course to do hand washing, sanitization, for us to recommend social distancing when out in public, etc. Now, those are standard for almost anyone who, whether they are in contact with a known positive or not. In terms of isolation, once both of these patients would have had 10 plus 3 days, they no longer meet criteria for home isolation or institutional isolation, or what we call quarantine. So I hope in the scenario that we would have described that the answers given for these are quite clear and easy to understand. This is more common than you think, and perhaps a lot of workplaces have had similar experience. So I'm grateful that this person would have asked this question, and it was asked a couple of times in varying ways, but I tried to summarize them to get the general concept across so that we can know and have a standardized approach. Because the more you know, the more you're able to fight this, and you're able to erase the gaps of ignorance that can lead to panic and misinformation and therefore irresponsible behavior. So we've looked at clinical scenario. I've told you about the safety of using masks, and I'm going to remind you that wearing the mask also gives you a dose protection for the level of exposure that you would have. So if you're wearing the mask properly and someone who is positive is close to you and breathes or coughs or sneezes next to you, instead of you being exposed to the full 100% of the virus as that person expels it, wearing your mask will protect you close to 100%. And if a few of those particles enter your system, it acts as almost like a vaccine, because that is how vaccines generally tend to work, to expose you to small amounts of the problem so that you then mount your own defense. So this is what another benefit that we are seeing that is coming out of wearing your mask. So we cannot stress enough that wearing masks is critical in the fight to protect yourself and those around you from contracting the COVID-19 disease process and from becoming really sick. There's a straight correlation between the exposure dose and the severity of illness, the number of persons admitted to hospital, the length of stay in hospital, and the mortality rate of persons admitted to hospital. So minimize your dose exposure by wearing your mask, wash your hands, maintain social distancing, and continue to boost your immune system by eating the right stuff. If you get access to the supplements and the tablets, feel free to use them, and continue to be safe and responsible. Thank you for watching, and I hope you have a good evening. And remember, tomorrow we'll be talking about lockdowns.